Hi, this is Amy Babcock, physical therapist with Agile Physical Therapy. We're going to continue our talk on bike fitting, focusing next on the foot, cleat, and pedal system. First thing we're going to start with is the foot and the cleat. So you need to know the difference between the different pedal and cleat systems. For example, speed play has more float than a platform. Platform is a one-sided entry and is more stable as compared to something like an SPD or an egg beater that are double-sided entry and more beneficial for a mountain biker. If you're not already familiar with the term clipless, this means that your foot is attached to the pedal, which greatly improves pedaling efficiency, but most people end up falling over a time or two when they first start with this pedal system. So you've decided to try clipless. Next, we have to figure out the cleat position. So the image on the left is of a road shoe with a look cleat. The one on the right is a mountain bike shoe with a SPD cleat. I've marked the one on the left with a Sharpie. You can see the little silver lines on there. The position of the cleat is very important as far as discomfort anywhere in the lower extremity from the foot all the way up to the hip. There are 5 primary cleat changes or positions. First is fore-aft or forward-back, medial-lateral or in and out position of the cleat, adding any tilting or wedging, the rotation of the cleat, adjusting for any leg length discrepancy, and additionally accounting for crank length. Cleat position changes are very, very small, within a few millimeters. They can also take a long time for making the adjustments, but they can be very, very beneficial for the cyclists, particularly with comfort in regards to riding several hours at a time. The fore-aft position of the cleat is measured at the metatarsal phalangeal joint, or the big toe joint. It aligns with the pedal axle, or perhaps slightly behind that MTP joint. Your crank should be level at 90 degrees when measuring. Helpful tools are a laser, sticker dots as shown here. You need to have a cleat screw kit. You might need to pick some dirt out, so a pick might be helpful. Screwdrivers and hex keys. The pedal axle is aligned close to or just behind the first MTP, whereas the 5th MTP, or the little toe side, is aligned closer to the pedal axle based on the anatomy of the foot. If you have soreness in the arch of the foot, you can try moving the cleat slightly forward in the shoe. If you have strain, pain in the calf or Achilles area, try moving the cleat backwards towards the heel. This is a foot model with the red line suggestive of the pedal axle. You can see that the first MTP and the 5th MTP do not line up in a straight line like the pedal axle. Therefore, some might find it more comfortable to have the center of the cleat behind the first metatarsal or the ball of the foot, while others find it more comfortable centered right over the first MTP. Other things to keep in mind. If you do move the cleat further back, you may need to adjust the saddle height, slightly lowering it. If there was discomfort in the arch and you move the cleat forward a little bit, you may need to raise the saddle slightly. The medial-lateral position of the cleat takes into consideration the width of the feet. In other words, if you were to stand and march in place, your feet naturally are a certain distance apart. If the knees are wider than the feet when you're riding your bike, you need to move the foot out by moving the cleat in. If the knee is dropping to the inside towards the top tube when you're riding, you may need to move the foot in or the cleat out. Oftentimes this can result in pain in the inside of the knee. Spacers can also be used if you're not able to adjust the cleat enough. Sometimes there's just not enough room to adjust the cleat. This is a good image of pedal stance width, showing pedals that are too narrow, indicating that we need to move the feet further apart. If that's not possible, you can use, again, spacers. You can also assess weakness, such as the outer hip, that can contribute to knees that drop the other way towards the top tube. A wedge can also be appropriate if the knee deviates both in and out. Wedges or shims can be used to adjust the tilt of the foot which will help align the knee and can be made in small increments. Wedges can help control overpronation of the foot, resulting in the knee dropping in towards the top tube. Unlike orthotics that we wear in shoes when we walk or run, when cycling, the rear foot is suspended, so adjustments need to be made at the forefoot across the metatarsals. Lasers can be used to help better assess alignment of the knee over the pedal. They can assess deviations and be used to help reassess after cleat adjustments are made. The frontal view, or view from the front, helps assess medial-lateral position of the foot, wedges or tilting, and rotation of the cleat on the shoe. You can see in this image the cyclist on the left, where I've drawn the red line, shows a little bit of deviation of the knee towards the top tube. This could be an alignment or bike fit issue, or it could be that she's just fatigued at the end of a long race. Rotation of the cleat can accommodate a toe-in or a toe-out position of the foot. However, too much internal rotation of the cleat, as shown on the right, could potentially increase tibial stress on the front of the knee, possibly resulting in patellar tendonitis or tendinosis. Too much external rotation of the cleats could increase pain and stress in the medial knee. In general, the direction your feet point off the bike will be the same on the bike. You can see on the picture on the right, the individual's right foot is turned out. When his foot was aligned straight, he was experiencing both knee and ankle pain. You can only adjust the rotation of the cleat so much before the crank arm is going to interfere with the rotation. It's suggested that you start in small increments based upon patient comfort as well as biomechanical assessment. Crank length is the last thing that we need to consider when looking at the foot pedal interface. This is based on the inseam, the frame size, the seat height, and perhaps limited hip mobility. As you can see from this image, a longer crank length will move the foot forward, increasing the required hip mobility or hip flexion of the cyclist. Below you'll find some general guidelines for crank length based on inseam, seat height, and frame size. When measuring the inseam, keep in mind your feet should be approximately 6 inches apart and providing as much compression as if you were sitting on the bike saddle. Before adding any length to a cleat, you want to be sure that you have an actual leg length discrepancy diagnosed by a medical professional. When you do, you can use alternating wedges or shims that have no angle to increase the length of the short leg. Tune in to the next video where we talk more specifically about saddle position.